Welcome, friends, colleagues, students, citizens of the world. This is your boy LeRoy Horton, back at you with another episode of the Teach Me Implants podcast. Now, I am flying solo today because I think I just wanted to talk about something that's been on my mind to a large degree for a number of years. I will tell you, personal disclosure, we had an incident in our family where we lost my brother back in 2017. He was hospitalized after having a status seizure because he had epilepsy, and he contracted an MSSA virus while in the hospital, which is a common hospital-acquired um, infection, and we subsequently lost him. Now, even before that, but even more so after that, I've always been very conscious about infection control. That's why people that work with me tend to hate me. And I'll show you, I got a presentation that I'll be sharing some information with you. And you'll kind of understand why. For anyone that's listening to this, if you are a provider, if you're thinking about being a provider, you have to realize that there is an immense responsibility that comes with caring for another human being. And that's the gravity of that license, of the ability to take someone's well being in your hands. And mind you, I'm a periodontist, so 99.999% of my cases do not involve life and death. We teeter in the invasiveness of our procedures, potential complications. When we sedate patients, there's always risk. But we're not like in my former episode with Dr. Estelle Williams. We're not performing emergency procedures where someone literally could die on the operating table. But they can die later. They can have high incidences of or high intensive infections that can land them in the hospital. That could be debilitating. That could potentially turn to something even much more serious than a localized infection. And we have to take that responsibility and write with the utmost respect. That being said, as a traveling dentist, I'll be honest with you, I was a little spoiled in that I owned two offices for the better part of 13 years. And so I was in control of systems. And I had an amazing team of sterilization techs and assistants, and even our front office that would, whenever possible, come in the back and help clean, sterilize, deep clean, as well as deep cleaning in the front. So I always felt that I did a good job. All right, and that's me tooting my own horn. I felt we did a great job. One of my most favorite employees ever, her name was Mary Lou Calico. She was a sterilization tech. And when I tell you the hardest worker, the most prolific sterilization tech I've ever had. If there was any downtime, she was never on her phone, she was never browsing the internet on the computer. She would literally have chairs turned upside down and she's scrubbing the scuff marks, the black marks off the wheels of the chair. She is climbing all over the office, getting every little dust bunny, every little potential speck of anything. I mean, shutting down rooms, lifting the dental chair high in the air, getting underneath, and toothbrushing areas. Love her to death. Not every office is like that. And now that I've been traveling for a number of years, I've been noticing this very disturbing trend. And maybe I'm just too anal about this. I don't know how you guys feel, but I feel that if I'm going to go to a provider or send my kids to a provider, or my mother to a provider, I want to make sure that the easy wins have been won. Keeping a clean office is the easiest win because you can do that without even having to see patients. Making sure that you're doing your spore testing and your sterilizers weekly, keeping a log, making sure that you're properly cleaning off the instruments. And when I tell you some of the things I walk into, and I'll show you some video here. Now, this isn't just me creating content or creating a story just for the sake of having an episode. I promise you, I have left offices and I have been asked to leave offices out of my stringentness on infection control and cleanliness. I had an office where, the every time I'd open a pack of instruments, there's that white gunk, right? It's that caked on composite, calculus, grime that it wasn't scrubbed off. It wasn't run through the ultrasonic. It was just tossed in the autoclave and it was just baked on, right? It's sterile, but it's someone else's bone on that implant drill. It's someone else's calculus and used composite on that ball burnisher. We know we've all been there. And if you're being honest, if you're a dentist and and this is what I do because people know my facial expressions now. I'll pick up an instrument, I look at it. If I see something, I go like this. And for anyone that's listening to this and not watching, you could probably imagine my face here. It goes, "Can I talk to you for a second?" So I'll take the assistant out, and I don't even know whose fault it was. I don't necessarily blame the assistant right off the bat, but I'll ask for a new pack of instruments. Or I'll ask them to clean them off. Sometimes it might be the only implant kit, surgical kit that we have in that office for that particular system that office is using. And I'll say, hey, I need you to take these drills, hand scrub them with a wire brush, get all this debris out. The little plastic inserts that the drills go into in the surgical kit, gunk gets in there. And a lot of people don't think that they got to clean in there and take the drills out and put that in the ultrasonic by itself. And I'll tell them, the whole schedule's got to wait. I'm sorry. There's a couple core principles that I follow, and that's, cleanliness. Obviously, I'm not going to run through the whole gambit of, managing patient expectation, consents, all of that. But cleanliness is one of my pet peeves, and we never rush surgery. So if something like that happens, and they've got to break that down, clean it well, sterilize it, and we just have to wait 30 or 40 minutes, then the whole schedule has to wait 30 or 40 minutes. I don't play with. I never rush a surgery, and I wouldn't want my surgery rushed, right? So I've made a few enemies. I've left a number of offices because of a refusal to meet even the most basic standards. And now this isn't, I can't say that there aren't grave consequences to the actions that we do, even though it's just a dental setting. We're not dealing with life and death usually in the moment, but we are absolutely dealing in life and death as far as what we can potentially transmit to the patient, what we can transmit from provider to patient, from patient to patient. And I got some horror stories for you. But I do want to start off, I'm going to share this video with this, to stay in the world of dentistry, this oral maxillofacial surgeon out of Oklahoma who actually, you'll hear the story for yourself, but I believe when I was finishing up to see what the consequences were, um, he had to pay fines. He had to go on probation. He had to have his license revoked. After 30 years of practice. But don't take my word for it. Here's the news story.
An oral and maxillofacial surgeon, just like Scott Harrington. He's practiced for 40 years and personally knows the man at the center of the investigation.
People are human, and I don't think Dr. Harrington did this on purpose. I think he just let it go, was careless and didn't realize he was being careless.
The 17-count complaint against Harrington calls the surgeon a menace to the public health. It alleges investigators found rusty or unsterilized surgical equipment, used the same vial of medication on multiple patients, failed to keep records of narcotics, and that untrained dental assistants use medications to sedate patients. Dr. Burnage points out that oral surgical offices are not inspected unless a complaint is filed. He says perhaps it's time for that to change, and offices who are doing things the right way have nothing to fear from increased oversight.
It needs to be pretty spontaneous and done in a constructive way, because I don't know of any doctor that would, of any kind, that would not support something like that. I would.
Now, you listen to that story, and it's heartbreaking, right? When you look at that indictment, it's using rusted over instruments, improper sterilizing, improper records on the sterilizers. He was letting assistants push drugs that were not trained to do so, presumably in his sedation cases as an oral maxillofacial surgeon. And that's disturbing because I can testify that I've walked into offices where people are breaking the most basic, whether it's infection control, whether it's HIPAA privacy, whether it's, standards of practice and diagnosis. They are horrible at this. And I always think, and me and my good friend Steve Page, who's my business partner for years, we always said, okay, we're just dentists, right? If there's that many dentists, and again, I'm not painting a sweeping indictment on all dentists. So it's a percentage of dentists. What that true percentage is, I don't know, but I know it's greater. Just from my anecdotal experience, is greater than I'm comfortable with. But imagine how many heart surgeons, general surgeons, plastic surgeons are doing this. Presumably, at least in the hospital, there's some greater controls, if for nothing else than for the profit motive, right? But I think St. Joseph's Hospital here in Tacoma, Washington, where I'm at, had a story 2, 3 years ago where, and subsequently that is where my brother contracted his infection before passing. But they had a whistleblower that was talking about the unsanitary delivery beds, and they had this nurse that showed they were putting napkins on the delivery bed and then lifting them up, and there was this yellow reddish liquid that was oozing up from the pads of the delivery mattresses. And so I'm worried. I am extremely worried that whether it's carelessness, whether it's trying to cut corners, one possible explanation I've had is that as a dentist, you may have learned this at some point, but a lot of us have always just relied on our staff. And when there's staff turnover, you might have the assumption that all these proper protocols are being taught to whoever is the replacement, but that's not always the case. And sometimes it might not be malicious, because someone may just not know what they don't know when they take a job. But it's your responsibility as the provider, because everything that happens, and that's one of the scary parts of our profession, is that everything that happens in my dental office is under the purview of my license. So if the front office messes up and shares protected information, who gets sued? I do. If an assistant messes up and hurts a patient, injures a patient, who gets sued? I do. If a hygienist messes up, injures a patient, hurts a patient, who gets injured, who gets sued? I do. And I always took that seriously. And again, I'm not saying this to cast aspersions or to be judgmental from some high horse as if I've been perfect, I've never had failures, I've never made mistakes. I'm 100% human and flawed. But I try hard on most things, especially things that can affect a patient's well being. I try my hardest to get it right. And I'm going to show you and share with you some more information here. And one of them is actually a video that I took a number of years ago from a clinic that I left. And I I'm just going to let the video tell the story. Now, in this video, let me give you the context of what's going on. I'm at this office, and I have complained to the staff before about how that they turn over the rooms and how they clean the rooms. I have found dirty instruments. I've lodged multiple complaints up the chain of command. So much so where I said, okay, you know what? I don't know how much longer I'm going to be here, but while I'm here, I will not walk into a room and do any treatment on a room until I feel comfortable that that particular room is clean to my standards. I couldn't control what the other general dentist was doing. I couldn't control what the oral maxillofacial surgeon were doing in that office. But in my room, this cannot happen. So if you're watching this, then the video tells the story. If you're listening to this on Spotify or Apple Podcasts, I would urge you to go to the YouTube channel because the video I cannot narrate this and do it justice the way the video is. Now, mind you, these are rooms that have supposedly been turned over and cleaned by assistants. Okay? And I double confirmed. I said, hey, room, oh, I can't remember the numbers. Let's just say room 1 and 2. Are you sure they're turned over? Everything is good to go? Oh, yes, doctor. We're good to go. We can bring the patient in as soon as they arrive. Okay. Video number 1. Right? Crap all over the floor. Impression material. Mud from shoes. Burrs. Video number 2. Look at this. Now, maybe other people don't care, right? This office stayed in business. I'll stop sharing here. Now, this is a very successful office, and surprisingly, some of the worst offices I've been to have been very successful offices. But of course, I had to leave because this was just a repeated number of occurrences. Now, and tell me if I'm doing too much. If I see that you don't uphold standards on the easy things, right? All right, walk with me here. If you're cutting corners, you're being lazy, or you just have such low standards on the easy things, can I now trust you that you are not exhibiting that same behavior on the more of the things of more consequence? Are you paying close attention to detail within your procedures, within your surgeries? Are you paying close attention and being honest in your billing, right? In your accounting of hours or doctor's production, and when you're trying to account for how much to pay somebody, like that's the part that bothers me. So even if I were to say, if all the patients said, hey, you know what's on the floor doesn't bother me, Dr. Horton, it doesn't bother me as long as everything else is clean, I'm good. Okay. Then that's a personal choice. I wouldn't go into an office where the floor was grimy, but that's a personal choice. But do you really tell me that you trust that someone that wouldn't mind walking through filth in a healthcare setting, you trust that they are cleaning the instruments any better? That they are making sure the sterilizer works? That they're spore testing weekly? That they're keeping a log? That they're training all their assistants? That everyone has all their HIPAA, OSHA, WISHA, infection control, bloodborne pathogens training? Are you instilling a culture of doing your best possible job? Again, not perfection, because none of us are perfect, but your best possible job. I wouldn't trust that if I walk into the office and there's a supposedly clean office, and there's used instruments and impression material, and what was that, a napkin, and what looked like a wrapper of some sort just on the ground. You know, I, and again, maybe that's just me, but I had to leave that office. I've been asked to leave other offices. I was at one very successful office where not only, I mean, not only were the instruments not clean, and we'll get to the case of emergency drugs, but this office, it took us 30 minutes to find the emergency drugs because they weren't in the cabinet that was labeled emergency drugs. But all the drugs were expired for over 10 years ago. 10 years, and this is a very successful office. And all I can say is, thank God you didn't have an emergency. Because, A, that's not defensible in court. But Jesus, you're a doctor. Don't you want to protect your patients? Don't you want to be prepared for worst case scenario? Again, maybe my standards are too high, but I don't even think I'm perfect. I just try hard. I, I mean, what else can we do except try? Now, when it comes to infection control, the rate of patient to patient infection sometimes is quoted and touted as being very low, right? Often it's because it's hard to actually tie it back because people might have, you know, they might not find out until years later. And what you really are waiting on is a cluster of people to all have a mysterious positive screening test for HIV, for hepatitis C or hepatitis B or whatever. And then when the health department does its contact tracing, which the health department does a really good job of contact tracing, they can statistically narrow it down to, X office and then do an investigation. Now, in this particular patient with that oral surgeon, I believe they tested, I want to say it was like 4,000 patients that had been seen over the previous 5 to 7 years. And I think there was one hepatitis C transmission. But I don't know if you remember recently in the news, there was a med spa. All right. Now, mind you, I as a provider, as a periodontist, I use a lot of platelet products in my surgery. And if you listen to my podcast with Patience Karsten, an amazing advanced nurse practitioner out of Yakima, Washington, that deals in non-healing wounds, but she uses platelet products too. But we are both committed to the fact that just because we feel and believe that we're doing advanced treatment doesn't mean that that's where the accolades stop in whatever we're doing. If you're doing advanced treatment, we're also doing advanced infection control. We've got advanced systems. The more invasive, the more advanced what you're doing is, the more advanced your systems of protection for the patient, for yourself, for the office have to be. But, and again, in the vein of platelet products, let me share this story here with you. All right, and this was a BBC report, but this was a New Mexico med spa clinic that was doing vampire facials, right? They draw your blood, they spin it in a centrifuge, they use all the good stuff, right? The platelets, the fibrin, the growth factors that are released by them, and they microneedle them into your skin. And this particular clinic, the story here, I'll be honest with you, is pretty gross. The person I believe that owned the clinic ended up going to jail for practicing without a medical license or practicing medicine without a medical license. But they had 3 women infected with HIV, and I believe over 58 women, or men and women, were tested as being potentially exposed to it, and 3 did test positive. So this stuff does happen. And you don't want to be in the news. You don't want to be that oral maxillofacial surgeon who had a transmission, but who got reported to the state and they said he was a menace to the public. And I'll stop sharing this here. I know I don't want to be a menace to the public. I'm not perfect, but I try so hard to do everything that I do with the utmost respect for the patient, the staff, for the clinic, for the well-being of the community, for that patient's loved ones, right? Because when you do something, it's not just the patient that's affected, it's their loved ones that are affected, their ability to potentially work, their ability to function. You have to take that seriously. Now, I'll give you an example. All right, and I know you guys are probably, you're hearing me ranting, and you're like, "Damn, LeRoy, you got more examples." I'll give you an example of how anal I can be about, sterilization and infection control. It was the last patient of the day, and we had done a number of surgeries back to back. This was recently. The sterilization tech had called out sick, so everyone was kind of helping out. And this office does a pretty good job. I mean, everything that, yeah, I haven't had to bring up much as far as my particular standards, but anything I have brought up, the owner is on it. Boom, we got you, no problem. So no complaints there. But what happens is, and I fear this happens in a lot of offices, on those days where you're short staffed, but you got a busy schedule and you got emergencies walk in, things fall behind, right? People come to the back and they see just mounds and mounds of used instruments and they're trying to make heads or tails of everything, try to get everything properly clean, and they're in a rush because they got to grab the next patient. And I'm going to show you a picture of one of my kits. And there was actually two of them that looked like this. And even though we were done with patients for the day and I had to leave, I'm only there once or twice a month, so I had to take my kits with me. I said, no, even though these are clean and they've gone through the sterilizer, I'm going to show you this picture right here. Now, if you're looking at this picture, what you're looking at is a cassette. It's been wrapped, it's been sterilized, but there was a gap in the wrapping. Now, I have to take these instruments back home with me, so I got a special traveling kit that I can put them in to keep them, protected from the environment. And I got to take them back to my house and then take them to the next clinic that I'm working at. So I am very, very cognizant of any little thing that could potentially contaminate what's supposed to be inside of this sterile wrapping. And you can see what I'm looking at on the screen right here. There was two kits like this. And I said, hey, you know what? This is no good. Even if you clean these perfectly, even if you put them through the sterilizer, even though by the time I use them on the next patient, they'll technically be clean, I don't feel comfortable traveling with this kit and this gap right here. So I had them rewrap it and actually double wrap it to confirm that there wouldn't be anything exposed. And I had them run them through the sterilizer once again, which means we got to sit there past closing time because your boy needs his instruments for his next work day. And like I said before, I do not skimp when it comes to just trying my best. It may not be the perfect system, but I try my best to ensure that we're not making those mistakes. Now, I mentioned to you a few minutes ago the expired drugs in that office that I was at. 2014. This is 2024. 2024. And these drugs expired in 2014. Um, I'm just at a loss for words. I'm not even going to edit out that pause because I am at a loss for words. But if you think that that's just, all right, LeRoy, you had one bad experience, you may not want to believe me. This is probably like the fourth office that I've been to over the last 4 years where it had expired drugs, no AED. This actual office, not only did they have expired drugs, but they had no defibrillation device. I've been at another office where the defibrillator had an expired battery from 2013, right? And I believe this was like 2021 or 22. Um, I've been to multiple offices where this is the case, where there's been staff turnover. People forget to check, for the expiration dates, and they don't want to pay Health First, who, and again, this isn't an endorsement for any. They're just the number one company that I see in a lot of offices. And usually what happens is people get it because they're told by the sales rep, oh yeah, we keep track of your expiration dates. Boom, we just mail it to you, send you a bill. As soon as you get in the mail, you swap them out so you don't have to think about it and there's never a lapse. But it's an expensive service, right? So doctors at some point, they start thinking, well, I could probably save myself a couple $100s a year and just keep tabs on it myself. But you're busy, doc. Doc, you're busy and you suck at that. Stick with dentistry. Allow the systems to help you, even if it's going to cost you a couple $100. But that's what happens, right? They try to save some money. This lapses. Now, if you don't believe me, that you think I'm just giving my own few, outlier cases. I actually, On the day before I was going to give this presentation, where the first hour and a half was talking about this soapbox moment of mine, one of my co-residents, Dr. Syed Umar, he was at office and he had a similar experience, and he texted me photos of the drugs, and I said, hey brother, you mind if I use these in my presentations? And he was like, yeah, go for it. Now mind you, obviously I'm not going to out any operating clinic, because he did talk to them, and they made it right. They got the new drugs. But I'm going to share my screen with you to show you the pictures that he sent me. All right, now if you're looking at what I'm looking, your eyes need to go down to the expiration date. Now mind you, this was 2025 that he sent this to me. Okay, 2025. Now, what do you see about these expiration dates here? July 1st, 2017. Everything in that entire kit had been expired 2017 and before, right? Now, this is epinephrine, all right? If you having a heart attack and, you know, you need some epinephrine because you're in asystole, right? You're flatlining, and you need some type of drug in the ACLS protocol to help get those heart fibers firing, so we can get some type of rhythm that we can shock. If you don't have this, or it's expired, your patient's at risk of dying, even more so than whatever state that they're in when they would need this. This is not defensible. You might as well, as my friend Amanda Okunde said when I did her sedation training years ago at the Oregon Academy of General Dentistry for moderate sedation. She was like, hand over your license and open your checkbook. That's it, guys. Hand over your license and open your checkbook. Now, I remember, this will be the last story, and I'll stop monopolizing your ear. I had first graduated, and I had worked for a provider who I had, and I think I actually still have some of the emails to the manager. I may have those still. But, I was super excited. I was fresh and green right out of school. And the stuff that I was seeing in this office was so concerning. So concerning. I reported it to the manager. I reported it to the owner. I got into some huge back and forth with the manager, not only on stuff that I was seeing as far as infection control and all that, but on what I saw some of the other associates doing. And I was basically told that, hey, just shut your mouth and do your job. If there's any problems, that's what the state board is for. It's not for you. And I'm like, well, the state board ain't in here day to day. They don't see this stuff. So unless what you're telling me is that you want me to go to the state board and see if they got a problem with it, I end up quitting. The other associate that I had complained to the manager about years later during COVID actually went to jail for trying to set his office on fire in Bellevue, Washington. Right. So that's the character of that cat. He was trying to burn his office down to collect the insurance money. And mind you, it's the heat of COVID. We could not get masks. And this dude was setting PPE on fire. Anyway, that's a story for a whole nother day. But I'm going to share this screen with you to show you what are some of the things that these local doctors, because you think I'm lying. Well, I hope you don't think I'm lying. I hope you believe me, because I'm hoping anyone here takes this seriously. But if you think I'm lying, I showed you some video. I showed you images that my friends are seeing. Here's this doctor that I actually worked for that I ended up leaving shortly after. And I'm going to share the screen with you one more time. Now, mind you, this is just a snippet from the AOL news, but this, local to me, this doctor, and you can look all this stuff up. So it's not like I'm outing anybody or maligning anybody. All this stuff, with all providers, you can go on the provider credential search engine that the state has, and it shows everyone's license. It says what's active. It says if there's any enforcements against them. But this doctor was missing emergency drugs in 2 different inspections, had inadequately trained anesthesia monitors as he was providing anesthesia for his surgeries, failing to provide documentation that showed the sterilizers for the dental tools were tested at least weekly using spore testing. Now, mind you, and I'll exit out of this is a pervasive problem, right? And not pervasive in that it's 100% of dentists that are doing this. But what's an acceptable percentage? 1%, 2%, 5%? Is that what, like, I don't want to gamble with those odds. I want to gamble that this is as rare as possible. But my concern is, as I am, traveling the state working and in multiple settings, and like I said, some of these are some high-end, successful practices. This is what they're practicing. Now, all I'm going to ask to end this episode is not that you are perfect. It's not that you jump on some bandwagon, because I know I tend to get on my soapbox rants, but I'm not claiming I'm perfect. But God damn it, I try. I try every time I see a patient, every time I'm in the office, and I have lost some popularity points with a lot of the staff because of how strict I am when it comes to that. So if you're a provider, if you're thinking about being a provider, from someone who does this for a living, from someone who has been successful doing it the right way, from someone who has lost a loved one due to a hospital acquired infection, may or may not have been preventable, I don't know. But I know what I saw that day in that emergency room that was filled to the brim, that was so full they had to make these makeshift curtain separated chairs in the hallways because so many people were in this emergency room. When I see, I don't want to get into it, right? You don't want your boy crying on here. But this stuff is preventable. And I want you to have in mind that you have the precious responsibility and license and freedom to actually work on another human being. Please, please, please take that seriously. Okay? Now, I'm going to end this episode because I've been in your ear. And when it's not a guest and you're just hearing my voice, I'm sure you're probably sick of it right now. All right? So I'm just going to end it. And I've got a couple awesome episodes in the edits right now that I'll be releasing over the next few weeks. But thank you for giving me your attention. If you have any questions, comments, or hell, if you want to come on the show and talk to me about it, share your stories, share your perspectives, I would love to have a follow-up segment. But until then, for everybody, keep reading, keep listening, keep learning, and I will talk to you soon.